It's time to sit down with someone you know. It's time for Debórah, bringing you the stars, the stories, and the performances. With your host, Debórah Benton. The Debórah Show is brought to you in part by these fine sponsors. AO Construction and Masonry Restoration Experts, specializing in marble, granite, sandstone, terracotta, and limestone. J.E. Washington Funeral Services Incorporated, faithfully serving you for 31 years. The Union Baptist Church Family with Pastor Michael H. Harrison. Dr. Hill and Associates in Women's Health of the Mahoning Valley Incorporated. And by Eagles Christian Preschool and Child Care. One school, two great locations, Youngstown and Warren. Today on the show, we're going to visit with someone in a profession that we all are sure we know something about, whether or not you have health care or annual checkups. Maybe you're fit as a fiddle. Still, everyone believes they know something about the life and times of doctors. Well, my guest today is so dynamic in his approach to medicine and, more importantly, to the care of his patients and his career. I thought it was well worth sharing. Please welcome to the show, Dr. Kenneth G. Cowens. Welcome to the show, Dr. Cowens.
Thank you, Debórah. It's good to be here.
So, first of all, let's start off by talking about where you grew up. I know you were born in Dallas, Texas.
That's right.
Talk about your upbringing. What kind of family did you come from? Was it a large family? Was it a functional or dysfunctional family? We want to get into what led you.
Well, both my parents were educators. My mother was a pharmacist, or is a pharmacist. As a matter of fact, she was the first black person in the state of Texas to practice pharmacy.
Oh, wow.
And she was the pharmacist at a small black hospital in Dallas that only had 60 beds, but it took care of the hospital care needs of 65,000 black people and Hispanic people in Dallas.
With 60
yes,
beds?
With 60 beds.
Wow.
It was owned by 6 doctors and a school teacher.
Were these also African Americans?
They were all African Americans. One of the owners of the hospital was a son of Youngstown, Ohio. His name was Dr. Mason.
Oh, wow.
And Dr. Mason was just an incredible man, just an extraordinary individual. He trained at Howard University in Washington, D.C. He then came here to try to do his residency training at one of the hospitals, and he was told flat out no. He went to Dallas. And he tried to get privileges at the Parkland Hospital, which is one of the flagship hospitals in the University of Texas system. They laughed at him. Dr. Mason said, I'm going to go build me a hospital, and I'm going to come back, and you will grant me privileges at this hospital to operate. Took him a long time, and he had to sue the state of Texas and take the case all the way to the Texas Supreme Court, but he got those privileges.
So you have fighting in your genes.
I have some very powerful, poignant role models who didn't know anything about backing down.
So how many siblings do you have?
I have a brother. He's a neurologist, and he practices in Texas.
Oh, wow. So did your parents encourage you or kind of guide you towards medicine, or was that just a natural proclivity based on just everything that you were around? Well,
it's a combination of both. My mother, when she would have prayer with us, she would always end by saying, and Lord, please let my sons go into professions that will make them of necessity to mankind.
Wow.
And then we would schmooze with all the doctors in the hospital that she filled prescriptions for. So it's kind of like a setup, you know.
So during that time when you really didn't know what path you were going to take, what were some of your earlier pursuits? Were you into sports? Were you a great student? Were you after the girls?
I was a great student. I was a nerd.
Okay.
I was a nerd.
And why might I believe that?
I was a nerd. I was a mediocre athlete, and I was a nerd. So I got this scholarship to a very prestigious prep school that really changed my life. It was called Green Hill Academy.
And where was that?
That was in Dallas. As a matter of fact, it was near South Fork Ranch, the place where they shot Dallas, the TV series.
Yeah.
It was out in that neighborhood.
Okay.
And that changed my life because there was so much money, and there was a whole different tempo of academic challenge that I had never imagined. And it just really changed my study habits. It changed my sense of competitiveness. it made me understand what my role as an African-American enfranchised individual was, because I was the first African-American to graduate from the school.
So was the bar much higher than what you would have expected?
Absolutely. Absolutely. It was higher not only in an academic sense, but it challenged me to be a different kind of mentally tough. That came in handy later on when I came south to study medicine and had to train at some occasions in predominantly white training institutions to finish my degree.
So when you were, shall I say, upping your ante in terms of your mental fortitude, who were some of the people who helped you? Did you have many mentors or role models while you were going through?
There was one individual who, in addition to Dr. Mason, Dr. Dorsey, the founders of the hospital where I worked when I was a nurse's aide, there was one gentleman whose name was Dr. Carl T. Gordon, Jr. Dr. Gordon was a graduate of Meharry Medical College, which was where I went to school, and he was what we call a field faculty member. That means that students who had to do their rotations to finish their training could go to a different city where there was a field faculty member practicing, and he would or she would take them under their wings and teach them things. He was the chief of surgery at an all-white hospital. He had been a bird colonel in the United States Army. He ran an evac hospital in Vietnam. He was very successful, very well respected, extremely competent, very loved, and he owned his own television station.
Oh, yeah?
Yes.
No, why didn't I get to know him?
No, I had never seen anything like this. This man made me believe that nothing, but nothing, was impossible.
What great role models to have in your life. You know, and if I can just divert for a second, that's something that the more I hear stories like yours, the more it really shows just how critical it is to have role models. And if you're in an arena or in an environment where there are none, boy, you've got a really hard road to hoe.
Well, in my early education, my first years in college were at Southern Methodist University, which is in Dallas, Texas. They call it the Harvard of the Southwest. And the academics were not the challenge. The challenge was what I call the 33 1/3 rule. African Americans have a 33 1/3 larger amount of stress in any given endeavor simply because of the American experience and our experience in America. The competition, the lack of social support, the lack of abilities to go to people who can mentor you, who will make you feel comfortable, who will read you, feel you, support you, help you to suit up so you can go out and do this well. Black people had, and I think in some cases still have a hard time finding that in predominantly white situations. So that was the problem there. That was the challenge there. I finally decided to finish my education at an African-American school, which was completely different because there wasn't that pressure. There was more of me left to focus.
Okay.
And there were black professors that I could talk to.
So when you say more of you left to focus, you mean now you weren't in so much maybe of an adversarial position where you could just focus on the work as opposed to maybe a lot of the other dynamics.
You could focus on the work. You could get kudos for good work. You had peers that you could relate to. You had friends that you could have relationships with. You weren't terrified that people would see a chink in your armor and use it against you.
So that's a lot to carry, especially as a young person.
Yes, it is. I don't think it's as bad now for a lot of us because things have changed, and they changed for the better. But I think there is a component of that problem still existing for our young people. And it distracts them, it confuses them, and sometimes it discourages them, even demoralizes them. So role models are very important.
Well, we're going to take a commercial break, and when we come back, we're going to hear more from Dr. Kenneth Cowens, and we're going to get into more of what you do as a physician now. We'll be right back on The Debórah Show after this. Stay tuned for more with Debórah. The Debórah Show is brought to you in part by L.E. Black Phillips and Holden Funeral Home, located at 1951 McGuffey Road in Youngstown, Ohio. L.E. Black Phillips and Holden Funeral Home, honoring the legacy of life. And we're back on the Debórah Show visiting with Dr. Kenneth Cowens. Dr. Cowens, okay, you gave us a little background just on how you came up and your mentors and role models and your education process, some of what you experienced. What did you, as an early, bright-eyed, ambitious, I'm sure, inspired young physician, what did you envision your career would be like?
Well, I have to go back to this experience, this story, because it really changed it didn't just shift my paradigm, it rotated it. When I was a second-year resident at Southside Hospital, I had in my clinic, my internal medicine clinic.
And I might add, Southside Hospital is a hospital in Youngstown, Ohio.
Yes, it is in Youngstown. It was in Youngstown. It no longer is.
Okay.
But it was where I did most of my training. One of my patients, whose name I won't mention, of course, was a very obese, middle-aged lady who had high blood pressure and diabetes, and who periodically would come into the emergency room of my clinic in heart failure. She would be sweating. Her heart would be racing. She would be heaving and wheezing. And we would admit her to the hospital. We would give her all the right medications. We would tune her up and stabilize her condition and send her home.
If I could just inject there, because we hear the term morbidly obese so much now, so that you can kind of define that for us. About how much did she weigh, if you remember?
She was 5'3", and she weighed 260 pounds. That, by any stretch of the imagination, is morbidly obese.
Okay.
Okay. So this particular time, she came into the clinic, and I'll never forget, she had wrapped in aluminum this great big ham sandwich smothered in mayonnaise.
Wait, what did she come to the clinic for? She came for lunch.
A routine visit. She came for a routine visit. She was scheduled to come. She kept her appointment.
And she brought a sandwich with her.
And was eating the sandwich. So I put a stethoscope on her chest, and her heart is beating like a Beach Boys tune. And I put it on her back, and she's wheezing. And her skin is wet because she's sweating, but she's steady eating.
While you're examining her, she's eating.
I'm examining her. So I tell her, we've got to put you back in the hospital again. You're in heart failure. So they come down.
She was in heart failure at that moment.
Yes. Legs were swollen. They come down. We put her on some oxygen. They put her on the gurney. And this is so poignant in my mind after all these years. She takes off the oxygen mask, puts it up so she can take a bite of the sandwich and put it back down as they are wheeling her to the monitor tour.
That didn't happen.
It did happen. And that troubled me indescribably troubled me in ways that I can't imagine. Long short, I go to one of my preceptors at the end of the day, and I'm venting to him and telling him and trying to express to him how frustrated I am and how the problem is that we have to educate our patients so they understand how they change their behavior so they don't come in and keep doing this and eventually die. And it fell on deaf ears, and I don't know which one bothered me the most, her ignorance or his ignorance.
Lack of concern?
I don't think it was a lack of concern. I think it was a lack of understanding.
Okay. But no, wait,
old school doctors, of which he was one, did not think in terms of educating patients. We stamp out disease and pestilence. We give you pills. We give you needles. We cut it out if we're surgeons, but we don't educate you. That was not a paradigm that people understood back then.
Okay. Wow.
So back then,
you were
I was frustrated. Soldier. So when I got out of residency, I had such a stone in my shoe about that. I was determined I was going to do something to educate people about high blood pressure. I just had to do something. It was just like it had to come out. So I did all the research I could and found everything I could about high blood pressure. And I bought at the Radio Shack a stereo system and a microphone and a headphone. And I went to my basement and I made a tape about high blood pressure. And then I went and took them to what was then the Farmore pharmacies, the drugstores.
Okay.
And we put 18 of the tapes in each one of the pharmacies.
And this was a chain store?
This was a chain store in Youngstown back then. So I waited several months, and by then my mother was here with me. She says, "How'd the tapes go, dear?" I said, "Mom, I'm not even thinking about it. That was just a delusion for me to think it would work." She said, "Well, did you call them?" I said, "Of course I didn't." She says, "Well, maybe you ought to call them." "Why?" "Maybe they sold out." I said, "Yeah, right." And I called each one of the 8 far more stores, including the ones in Pennsylvania. They had all sold out except for the one in Austintown.
So all the ones in Ohio
They're
and
all
PA.
sold out.
Wow.
Wow.
That was a wake up, wasn't it?
Yes, it was.
Okay, so now you've had this really life-altering experience, career-altering in terms of your focus of your career. Now, before you had that experience, what did you think was going to be your primary focus as a physician?
What I'd seen people like Dr. Mason do, Dr. Perry do, other physicians that I had the privilege to watch.
Just mainly general?
Just practice medicine, see patients, and make a difference that way. But that's not good enough. It wasn't good enough then, and while it's better, it's not good enough now. We have a major problem of literacy.
Okay, that's another question I want to ask you about, because we had talked before, and you were explaining something to me about, which, did you call it health literacy?
Yeah, well, yes.
And my thinking was, okay, health literacy means things like you basically, when something is explained to you, you understand what the doctor is saying. If he's talking to you about hypertension, or if he's talking to you about diabetes, or you know, just the basic things, but that wasn't it.
No, there's more to it than that. Health literacy, to my mind, is multifaceted. It doesn't just deal with basic English or language literacy. It doesn't even just deal with a patient consumer's ability to understand what medical ease is, or what the system is talking about, or the instructions that the person's given so that they can interact with the system. The other component that is just as critical is the care provider's ability to understand the language of the people they're trying to take care of. Wow. That's very critical.
Well, and just off the top of my head, I can imagine, we know that in at least, I'll use this area, for example. We're in Youngstown, Ohio, and in this area, you have doctors from varying nationalities. You have doctors, and I've even experienced, like, if you go to emergency and there's someone attending to you, you can't understand them very well, and I'm sure it becomes an exacerbation on both parts when you have to keep asking somebody to repeat what they said, say it slower, those kinds of things. So does any of that speak to what you're talking about now?
What you say is very true and very common, but even that is a small component of the bigger picture. You have people who are learned and mastered in the King's English who don't have the capacity to, let me put it in the argot of the vernacular, break it down to the people they're talking to, so the people they're talking to and trying to help can understand and assimilate the information, become empowered, and do what needs to be done, so the net effect is that they're better.
Okay, so give me an example of, if you were in that capacity where you didn't take time or weren't able to break it down to me, I come to see you on something, and what might just kind of do a reenactment with me, just so I, along with the viewers, can really get a good concept, because sometimes you can go through something and it can be so commonplace you don't realize that that's what actually happened. So can you give us an example?
All right. Okay, let's just say that I write you a prescription for an antibiotic and you have an infection, and you have to take 2 pills, that is 1 pill twice a day, until they're gone, to resolve the infection. You have to take it with food. I want you to eat some yogurt so you don't get diarrhea. And you must not save any of the pills. Now, if I leave it there, you're probably going to hear, well, I'll just take the pills till I get better. And I'll be really smart, and I'll save 2 or 3 of them, so the next time I get infected, I won't even have to pay a copay.
Oh, wow.
Right?
That happens a lot?
Oh, gosh, yes. What you really want to say to a person, if you want them to understand, all right, we are dealing with some junkyard nasty bugs out here. You've got a sinus infection, or you've got a urinary tract infection, and you don't have to miss but 2 or 3 doses of this antibiotic to mutate this bug into something that will come and get you. If it's a sinus infection, you can get pneumonia. If it's a bladder infection, you can get a kidney infection, both of which can kill you. These medications were balanced. They were prescribed at a given dose to be taken at a given interval for a duration of time to eradicate this infection. If you do your job, they will work. If you don't, we have a problem.
Well,
do you drink alcohol? Don't drink alcohol, because alcohol dehydrates you. It shuts down your immune system, and it neutralizes the antibiotic, and it's a good way for you to get sick. Now, these are the things that we all know.
Now, you didn't just make that up. Those are realities.
Yes. These are things that I know, that I, representing the healthcare delivery system, know, but I don't take the time to tell you with clarity and emphasis so you understand that playtime is over and you need to go walk the walk.
Wow.
That's the other component of illiteracy. That's my component.
So, Dr. Cowens, where do you begin?
By telling the truth.
But I mean, you're one physician, and I know everybody that I know has taken antibiotics. What you just broke down to me, I happen not to consume alcohol, but most of the people that I know, they may drink a little wine or something, and I don't know anybody who knew what you just, most of the people I know, they know you have to take it until it's gone. But the other things that you've said and how it can lead to kidney problems and you know, with the sinus infection, pneumonia, and definitely what you mentioned about mixing it with alcohol, I don't know anybody who knows that.
Well, I think one thing that doctors have come to do is that we feel as though we have to be nice all the time. And the reason we have to be nice, and I'm being nice by saying be nice, because we're afraid that if we alienate a patient, say something offensive, and they get up and walk out and pick up the phone and call the insurance company, that we may be taken off the panel. All right? One thing that we lost as doctors years ago is the understanding that we are the white knights. We are the patient advocates. There is nobody in the healthcare delivery system that has more of a right and a responsibility to be the patient advocate and protector than the doctor. We lost that, and we need to get it back. Patients want us to get it back, and we haven't done that.
Now,
And the place and the way to do that is to tell the truth. How do you gain the respect and the affection and the abiding loyalty of a child?
Honesty.
Tell them the truth.
Yeah.
Children have an uncanny capacity to understand and become empowered with the truth if that's what you give them. In the sense that patients are looking for guidance and help, looking for something they can count on, something they can have faith in, and something they can be empowered by. They're looking to us to be that source of truth, and we aren't doing it. We aren't coming straight. It's not a time to tell people things they want to hear. It's a time to tell people what they need to hear and no uncertain terms.
Especially as it relates to their life.
That's right. That's right. Down the street from your studio, years ago, we gave a presentation about diabetes at a church to a group of ministers. And we talked about type 2, type 1 diabetes, and a minister got up in the front and told me in no uncertain terms, I'm not going to see my doctor if I don't want to, and I'm not going to take that medication if I don't want to. And everybody just kind of looked at him and kind of tuned in because most of the individuals were men. I said, you know what, if I was your doctor and you were my patient, I would get you to take out a life insurance policy. And I would make me the beneficiary, and I would pay the premiums.
Because you knew.
That's right.
Just, oh, my goodness.
And I would take good care of you. I would do everything in my power to make sure that you got good care. But I would be the beneficiary of that life insurance policy. You could have heard a pin drop. I had everybody's attention after that.
I guess.
Now, that was a pretty bold move, even for me. but that's the quality of honesty and energy and passion that I think we need to start bringing to the table. I think people want it. I think people need it. And I think it'll make a positive difference.
Well, we got to take another commercial break. When we come back, I'd like to discuss with you what I believe is your big passion, which is metabolic syndrome.
Yeah.
So we'll be right back with Dr. Kenneth Cowens after this.
There's more to come with Debórah. Are you looking for office space for your business with room to grow? Look no further than Park South Development, right in the heart of downtown Youngstown. Whether your taste is for a luxury suite with a view, or just the basic professional setting, or something in between, Park South Development offers prime location, excellent maintenance, reasonable rates, and a secure facility. So give them a call. Word is, Park South Development tenants are the happiest in town.
And we're back on the Debórah Show with Dr. Kenneth Cowens, and he is just sharing with us his passion for the medical profession that he practices as well as for his patients and their care. So Dr. Cowen, just before we took the break, I mentioned that I was aware that you are very passionate about the metabolic syndrome. And would you start off by explaining to our viewers what that is?
All right. The metabolic syndrome, first of all, the syndrome is when several different conditions come together
to
cause or to make happen certain other conditions. They increase the risk or frankly cause other conditions. It's not quite the same as a disease, because in a disease state you have a reproducible, very reliable, if this, then this kind of relationship. That's not quite what you have with a syndrome. A syndrome is a collection of conditions that just happen to come together, and then you get these bad things that occur as a result of that.
For great interviews and live performances, tune in the same time each week for Debórah, or visit us online at thedeboraahshow.com.